7 important questions about high fever. How can I differ a high fever from common runny nose? After associated symptoms. High fever is a runny nose that occurs along with sneezing, itching, and a feeling of blocked nose. Lacrimation and redness of the conjunctiva are also characteristic. High fever is aggravated by contact with allergens, for example in the park. With ordinary rhinitis, the watery discharge becomes thick in 2 to 3 days, passes after 7 days. Sometimes it is associated with fever and weakness. Which allergens cause hay fever? It is most often caused by pollen of plants, hazel and alder bloom already in February to March, beech and poplar in April, and pollen of grasses which bloom from the second half of May to the end of the June. And even longer, we also include cereals. If we get allergy symptoms in August, we are most likely allergic to weeds such as mugwort. Is it necessary to go to an allergist immediately? No. Your personal physician will help. If it is in the middle of the pollen season and we have severe allergy symptoms, he should give us medicines right away. Most often, in mild allergic rhinitis, it is an antihistamine, and in severe symptoms, additionally a nasal steroid. After the pollen season, in the fall, ask for a referral to an allergist. How can we help ourselves until the time of visiting the doctor? By taking medicines without a recipe. Ideally, they should be second-generation antihistamines. Ask about this at the pharmacy. The safest are preparations based on loratadine, desloratadine, rupatadine, and fexofenadine. They do not cause side effects, drowsiness, constipation, or visual disturbances. They can be safely used up to 4 pills a day. Hay fever can occur at any age, even if we are not allergic to anything before. Can I use nose drops that shrink the muscles? Yes, but only 3 to 5 days. Longer use of the drops causes the so-called drug-induced rhinitis. The mucosa loses its natural properties to physiological contraction, and as a result, we constantly have a stuffy nose. Therefore, with high fever, it is better to use pseudoephedrine pills instead of drops. What rules to introduce every day to reduce a runny nose? Let's start flushing the nose. This way we will remove allergens from it. This is done with saline of seawater. It is worth choosing those enriched with anti-allergic manganese. It is also important to take off your outdoors clothes and change your clothes at home. After coming from the outside, it is also worth taking a shower and washing your head. The apartment is best ventilated in the early morning or late evening. What to do if my symptoms do not give away after taking medicines? Therefore, it is necessary to desensitize. After the season, this is in the fall, we should see an allergist. He or she will order blood or skin tests. In spring and summer, it makes no sense to do skin tests, as the patient usually takes anti-allergic pills. After determining the cause of the allergy, we can protect ourselves for the next season. Desensitization to plant pollen is 90% effective.